Essentially, my project was focused on looking at cancer patients and while they're going through treatment and seeing how the treatment specifically affects their heart. And specifically, I pursued this through looking at pre versus postmenopausal patients because as a patient transitions into menopause, their fat storage kind of shifts into what's a little bit more of unhealthy fat storage, what's known as intraperitoneal fat.
The main measure that we use in my particular study is left ventricular ejection fraction, which has to do with how much blood the heart is pumping with each of its contractions. And basically we looked at data that was baseline, like somewhere midway, about 3 months, 6 months, and then 24 months after their chemotherapy. And what we determined to be high risk is a patient who we predicted to have a decrease in LVEF to less than 10% of what they had before, or to less than 50% totally.
You know, a lot of cancer patients don't actually die from the tumor itself. It's mainly from the cardiac complications that come during and after treatment.
There's a very large number of women specifically who survive breast cancer, but their number one risk of death or cause of death after they've survived the chemotherapy is cardiovascular disease.
This collaboration called REACH, which stands for Research Experience in All-Around Cardiovascular Health. What it does is to provide opportunities for William & Mary students to spend the summer working with researchers at the Pauley Heart Center. We have lots of great research at William & Mary, but we don't have anybody who's studying large populations of heart attack victims. And that's what they have at VCU. That's one of the things they have. We don't deal with medical records here. They do. We don't have large medical sociology studies going on. They do at VCU. And so it's an opportunity for our students to get firsthand experience, not just read about those things in papers, but get firsthand experience in actually doing that kind of research.
So for my thesis, I was kind of expecting to find that postmenopausal patients were going to have a greater decline in their heart function just because of that shift into more unhealthy fat storage. However, I kind of found the opposite, so I found that premenopausal patients actually were having a greater decline in their heart function. And one of my predictions was as to why that was because patients, as they age in general, start having high blood pressure and all these other sort of cardiac related comorbidities that come along with just aging in general. So some of them were taking other sort of drugs like ACE inhibitors, beta blockers, things like that.
If this model continues to be built and continues to be very accurate, they can use it to basically look at a patient and say, this particular patient is high risk for cardiovascular disease. We should start putting them on medications. We should start watching their heart and health earlier on so that it can help them to be more healthy as they undergo chemotherapy and afterward. It's really cool to know that there are so many students like me who are getting involved in this research.
Seeing all the research that's been done already and the paths that we're going down gives me a lot of hope for cancer patients in general and survivorship.